Medical care. Excerpted from Time on the Cross, The Economics of American Negro Slavery by Robert Fogel and Stanley Engerman. This book was published in 1974. While the quality of slave medical care was poor by modern standards, there is no evidence of exploitation in the medical care typically provided for plantation slaves. The inadequacy of the care arose not from intent or lack of effort on the part of the masters, but from the primitive nature of medical knowledge and practices in the antebellum era. That adequate maintenance of the health of their slaves was a central objective of most planters is repeatedly emphasized in instructions to overseers and in other records and correspondence of planters. The preservation of the health of the Negroes, wrote J.A.S. Acklin to his overseer, and the care of them when sick will require your best attention, and to be ignorant of the best mode of discharging your duties in these particulars is to be unfit for the responsible station you hold. P.C. Weston charged his overseer most distinctly to understand that his first object is to be, under all circumstances, the care and well-being of the Negroes. Consequently, all sick persons are to stay in the hospital night and day from the time they first complain to the time they are able to work again. The nurses are to be responsible for the sick not leaving the house, and for the cleanliness of the bedding, utensils, etc. The nurses are never to be allowed to give any medicine without the orders of the overseer or doctor. A woman, beside the plantation nurse, must be put to nurse all persons seriously ill. In all cases at all serious, the doctor is to be sent for, and his orders are to be strictly attended to. No alteration is to be made in the treatment he directs. While planters worried about slaves who feigned illness to get out of work, they were generally more concerned about losing slaves or impairing their health through the neglect of real illness. Thus, Bennett H. Barrow, owner of one of the largest Louisiana plantations, treated slaves as though they were sick, even though he thought they were pretending. Nor was Barrow alone in this attitude. In their sick records, planters sometimes described the malady which had removed a slave from production as nothing, complaining, and more lazy and mad than sick. James Hammond insisted that every reasonable complaint must be promptly attended to, and with any marked or general symptom of sickness, however trivial, a Negro may lay up a day or so at least. Unless it is a clear case of imposition, wrote still another planter, a Negro had better be allowed a day's rest when he lays up. A little rest often saves much by preventing serious illness. Facilities for the treatment of the sick generally varied with the size of the plantations. The larger plantations maintained substantial hospitals. On one plantation with 168 slaves, for example, the hospital was a two-story brick building which had 8 large rooms. Such hospitals usually contained separate rooms for men and women. A special room was often set aside for confinement cases. One or more of the rooms were clinics for the treatment of outpatients. These rooms contained a pharmacy, as well as other equipment needed for ministering to the sick. On smaller plantations, the hospital was merely an ordinary cabin, reserved for the sick. In some instances, masters set aside several rooms in their own houses for use as a hospital. The rationale for hospitalizing slaves was twofold. It permitted the sick to receive special care, including not only rest and medication, but also special diets. It also isolated the sick slaves from the healthy ones, and thus minimized the danger of contagion. Many planters insisted that slaves be removed from their cabins to hospitals as soon as their illness was made known. Few plantations were large enough to justify the exclusive retention of a full-time physician. However, Virtually all plantations of moderate or large size had at least one full-time nurse, usually an elderly slave, and many also had experienced midwives. The nurses and midwives worked under the direct supervision of the planter or his overseer. Planters sought to be, and overseers were expected to be, knowledgeable about current medical procedures and about drugs and their administration. Physicians were regularly brought into the plantations to care for slaves whose health problems could not be treated adequately by the nurses, midwives, overseers, or planters. Some planters contracted for the physician's services for a year at a time, paying a flat fee that was usually proportional to the numbers of persons covered by the contract. Others paid for services as rendered. In either case, the doctor attending to the slaves was usually the same doctor who ministered to the planter's family. Bills submitted by these physicians indicate, time after time, that they treated both slaves and members of the master's family during the same visit. That it was generally the intent of planters to supply slaves with medical care of a relatively high quality does not imply that the objective was usually realized. Not only was the state of medical technology and arts quite primitive during the antebellum era, but the prevailing theory of disease frequently led to treatments which were inimical to the recovery of patients. Disease was assumed to be caused by poisons emanating from decaying animal and vegetable matter, which were transmitted to human beings by impure airs and waters. To rid the body of these poisons, doctors resorted to bleeding, blistering, and purging. Bleeding and purging were a standard treatment for such diseases as dysentery, cholera, and pleurisy. In each case, of course, the prescribed treatment removed from the body fluids that were vital to recovery. The therapy, no doubt, hurried to their graves many patients who might have survived if they were spared the services of doctors. For many of the illnesses that afflicted slaves, especially pneumonia and diseases of the gastrointestinal tract, which were the greatest killers of blacks, the services of doctors were either useless or harmful. It was only in limited cases, such as smallpox and malaria, after the 1880s, when sulfate of quinine became generally known, that doctors possessed effective pharmaceutical weapons. Beyond these, the useful medicines contained in the chest of doctors were primarily anodynes, such as opium, panagoric, Dover's powder, and laudanum, which, although they did not cure, at least served to relieve severe distress. Doctors were effective in cases requiring minor surgery, such as opening abscesses, removing teeth, and the setting of broken bones. They were also helpful in dealing with hernias, which were quite common among slaves. Although they lacked the surgical knowledge needed to repair the rupture, they did prescribe the use of trusses. The prevailing theory of disease did have one quite salutary effect. It led many planners to adhere to a hygienic regimen. Few matters were more frequently emphasized in the instructions to overseers than the need to ensure not only the personal cleanliness of slaves, but also the cleanliness of their clothes, their bedding, and their cabins. Instructions required overseers personally to see that they kept their clothing mended and clean, and that they washed their clothes as often as once a week, to which purpose time must be regularly set apart the latter end of the week. He must see that they are clean on Sundays and not straggling about the country dirty and ragged, and he must see that they appear clean every Monday morning in the year, without any failure whatever. He must see that they keep their houses clean and their yards free from weeds and filth. Some planters went even further. Hammond required a complete cleaning of slave cabins twice a year. During these spring and fall cleanings, all contents of the cabin were to be removed and sunned. All walls were to be washed, mattresses were to be restuffed, and the grounds under the houses to be sprinkled with lime. Once a year, every house was to be whitewashed inside and out. The punishment for slaves who failed to keep themselves personally clean was a forced scrubbing by a driver and two other blacks. Another planter required the ground under the cabins to be swept every month and had cabins whitewashed twice a year. Charles Tate, a leading planter in Alabama, required the cabins of his slaves to be moved to new ground every fourth year to prevent filth accumulations and cholera or diphtheria. Slave health care was at its best for pregnant women. Pregnant women, wrote one planter, must be treated with great tenderness, worked near home, and lightly. Light work was generally interpreted as 50 to 60% of normal effort and was to exclude activity which required heavy physical effort. During the last month of pregnancy, work was further reduced, although various planters felt, as did P.C. Weston, that pregnant women are always to do some work up to the time of their confinement, if it is only walking to the field and staying there. On large estates, women were usually confined in the lying-in ward of the plantation hospital. In normal cases, the delivery was usually handled by a midwife, but if some difficulty in the delivery was anticipated, a doctor was called in. The period of confinement generally lasted about 4 weeks, during part of which time mothers were attended to by a midwife or a nurse. There frequently followed another 2 weeks of light work in the vicinity of the slave quarters. Women were expected to nurse their children and hence were kept on relatively light work schedules for the balance of the year. Until the 6th or 8th month after birth, nursing took place 4 times per day during working hours, and nursing mothers were expected to work at only 50 to 60% of normal levels. For the balance of the first year, infants were usually nursed twice a day during hours of work. Demographic evidence gives strong support to descriptions of pre- and postnatal care contained in plantation rules, letters, and diaries. Computations based on data from the 1850 census indicate that the average death rate due to pregnancy among slave women in the prime childbearing ages, 20 to 29, was just 1 per thousand. This means that out of every 167 women in this age category who gave birth, only 1 died. The slave mortality rate in childbearing was not only low on an absolute scale, it was also lower than the maternal death rates experienced by Southern white women. The mortality rate for infants was less favorable than that of their mothers. Of every 1,000 slaves born in 1850, an average of 183 died before their first birthday. The death rate for white infants in the same year was 146 per 1,000. In other words, the infant death rates for slaves was 25% higher than that for whites. This finding appears to give credence to charges that mean treatment of infant slaves was widespread. In doing so, it raises the strange paradox of planters who treated pregnant women and new mothers quite well while abusing their offspring. Work on the demographic data for 1850 and 1860 has not proceeded far enough to permit a full resolution of this paradox. Definite answers to many of the questions posed by the relatively high infant death rates experienced by slaves are at least several years off. The work thus far, however, has revealed little evidence to support the charge that masters neglected the care of the infants. Most of the difference between the infant death rates of slaves and free persons appears to have been due to the fact that the South was less healthy than the North. The infant death rate of Southern whites in 1850 was 177 per thousand, virtually the same as the infant death rate of slaves. Along this dimension, then, exploitation of blacks arose because slavery was confined to the South and because slaves were not free to choose where to live. By and large, slave deaths during the first year of life, like those of free infants, were due to diseases such as whooping cough, croup, pneumonia, cholera, and various maladies of the gastrointestinal system, diseases about which the men of the antebellum era had little understanding and over which they had little control. Of those causes of death that apparently could be controlled, suffocation was most significant. About 9.3% of the slave infants who died in 1850 were reported to have succumbed from this cause. Among whites, only 1.2% of infants were reported to have died from suffocation. The excess of the slave suffocation rate over the white suffocation rate accounted for nearly 15 deaths out of every 1,000 slave births. There has been much debate among historians as to the cause of infant suffocations. Some have attributed them to infanticide, arguing that life was so unbearable for slaves that many mothers preferred to kill their young rather than to rear them in bondage. This argument is undermined by the extremely low suicide rate among slaves. Less than one slave in every 10,000 committed suicide in 1850. That was only one-third of the suicide rate among the white population. Others have used suffocation as evidence that neglect of children by slave mothers was widespread. While one cannot rule out the possibility that deaths due to suffocation reflected neglect on the part of mothers involved, the fact remains that out of every 100 slaves born, less than 2 infants died from this cause. The mortality statistics, therefore, leave plenty of room for slave mothers who gave their children tender care. Nor should one necessarily accept the statistics on slave suffocations at face value. Many deaths that were interpreted as suffocation because of the absence of a prior fever or other than accepted symptoms of illness could have been caused by undisclosed infections. That more such deaths were reported as suffocation for slaves than for freemen might have been due to a jaundiced view of the overseers, who reported the death statistics to the census takers. Neither the 1850 nor the 1860 censuses collected information on morbidity. The only currently available data comes from a sample of 545 field hands who lived on 15 plantations. This sample provides information on illness rates during 2,274 man-years of labor time. It shows that on average each slave was sufficiently ill to be absent from work for just 12 days per year. This low illness rate tends to support the impression that slaves were well cared for. It also calls into question the widely asserted contention that slaves were always feigning illness. At the very least, the low absence rate shows that if pretense to illness was widespread, slaves were singularly unsuccessful in their deceptions. For many, statistics on life expectancy are the ultimate measure of physical well-being. Figure 36 compares the life expectancy of U.S. slaves in 1850 with those of freemen in various places between 1830 and 1920. Although the life expectation of slaves in 1850 was 12% below the average of white Americans, it was well within the range experienced by free men during the 19th century. It was, for example, nearly identical with the life expectation of countries as advanced as France and Holland. Moreover, U.S. slaves had a much longer life expectation than free, urban, industrial workers in both the United States and in Europe.